The journey to health equity has a long way to go. We're going to hear the case of Scott, who is now 33 years of age, a jazz musician here in New Orleans, who had inadequate insurance or essentially no insurance, and Scott is going to tell us his story.
Okay, well, let's start back February 2000.
Okay.
All right. So I know one night I just started feeling this pain in my upper right abdomen, and it's swelling. So I ended up taking myself to the emergency room, and the doctors told me that I had gallstones lodged in my gallbladder. So they set up an appointment to see a surgeon. And then I saw him again about maybe a week later to do the consultation to schedule the surgery. And when they took my blood pressure, it was about, I think, 220/110. And that's when he immediately walked me upstairs to see a physician.
Did you get the surgery?
Well, we scheduled the surgery for, I think, around mid-March. And then the secretary for the surgeon, she called me back. I was at my house, and she said, there's a blockage. We can't get approval for your surgery. So I called the insurance company, which is a short-term 6-month insurance plan. And they told me, they said, hey, we don't cover, gallbladder surgery until after 6 months, but I'm only covered for 6 months. So I called a friend of mine, and he sells insurance, and he told me, he said, hey, you need to look into getting the Affordable Care Act. I said, okay. So we went online that afternoon and we filled out everything. And this was in March, but he said coverage will start April 1st. So I rescheduled the surgery for the gallbladder on April 7th. And right before at the end of March, I started feeling a little weird. So I went to the emergency room. I think it was the last day of March. And they sent me home and said, well, it could be your diet, or we just don't, we don't think it's anything serious. I went home, and then I had the surgery on April 7th, and they released me on April 8th.
Affordable Care Act is now in place.
Yes, it is.
You really were uninsured April 1st. You really didn't have any insurance.
Yes, so I still was feeling just a little weird, and I contacted my physician. I said, hey, I'm still having some issues here with the heart. She said, okay, well, let's schedule you an echo. So we did it April 10th.
So the echo was covered, the surgery was covered?
Yes.
What did the echo show?
You sat down with me, and that's the first time I heard the term congestive heart failure. And when you were going over the paperwork with me, you said your ejection fraction rate was something, I think it was 20%, 25%. And some parts of the walls were not pumping correctly. So then we did a stress test, and we also did the
angiogram.
Yeah, the angiogram.
The angiogram was negative. You didn't have any blockage.
Correct.
So
correct.
we used medications. You had lisinopril, then losartan, and carvedilol.
Yes, and rehab.
And you wanted diuretic. We referred you to cardiac rehab. So
Right.
you did better.
Correct.
You were feeling better. Your blood pressure came down. You also were on atorvastatin for your cholesterol. So that's about 5 or 6 medicines. How much did all those medicines cost?
It didn't cost anything, actually. I was covered under the Affordable Care Act.
What about the pre-existing condition you had with the gallbladder?
That was ruled out. The hypertension pre-existing condition, that was
It covered all of that.
It covered everything.
So 2015.
15, yes.
Doing a little better. Blood pressure's better. Numbers looking better. But you still just didn't feel right.
Didn't feel right, yeah. And I asked my physician if she can refer me to go see an endocrinologist. The endo say, I think that you may have Cushing's disease, when we consolidated all the symptoms. Nothing was done right then. And I went to see my nephrologist and about the kidneys, and he said the same thing. So I had a follow-up appointment with the endo, and that's when he said, okay, we're going to start doing, some blood work. We did a little more blood work. He said, hey, I'm going to order an MRI just to check. So he ordered the MRI, and he did find a benign tumor in the wing of the pituitary gland.
Your surgery was unsuccessful at first due to nasal passage blockage.
Correct.
But it was eventually successful. We're now in November of
2016, November 21st, 2016. I had the surgery was successful because the cortisol level went from rocket sky high to non-existent. So they started me on, the supplement, the steroid.
Now you're a jazz man, so you're
Right.
self-employed. You're doing better. You still feel a little weak. You can't gig as regularly as you would like to in the jazz orchestra and some of the other bands you play with.
Right.
But you are doing better.
I am. Overall, I am doing better.
All right, so let's go to this year. We're in 2017.
Yes.
We've reevaluated your heart. I think your ejection fraction now is in the 50s, 55, 60%.
Yes.
Your blood levels are better. Your glucose is better. You still have chronic kidney disease, but it's improved.
Right. I am. I'm off all the blood pressure medication, and the blood pressure.
But you're on the Corvalol still.
Still, I'm on. Yes.
How much did all this stuff cost? You had gallbladder surgery. You had echoes, nuclear stress tests, coronary angiography, studies for pituitary gland tumor, MRI,
Sleep studies.
surgery, sleep studies. So how much did all this cost?
Over $500,000.
So you would have been bankrupt if you had had no insurance to try to do all these things.
We would not be having this conversation right now if the Affordable Care Act was not in place for me. For one, I'll be dead.